Today we're going to be given an intramuscular injection. Before we get started, let's go over the sites. There are four main sites. There is the deltoid, there's vastus lateralis, there's ventral gluteal, and dorsal gluteal. When giving a deltoid shot, you want to use a three-finger technique. You're going to put your three fingers at the top of the deltoid, bring your pinky out, and you're going to inject after the three fingers. On the dorsal gluteal, you want to take the buttocks and take one cheek, and you want to draw a square. And then from there, you're going to draw a cross, making 4 equal squares. You want to inject that shot in the uppermost lateral side of that square to make sure that you are not hitting the sciatic nerve. The gauges for the needles that we use is 19, 20, 21, and 22, and needle lengths are 1 inch, 1.5 inch, and rarely 2 inches. We're going to check the doctor's orders. The doctor's order 0.4 milliliters of water. Since it is water, we're not going to have to check for platelet counts or any lab values or any other assessments because there are no allergic reactions to water. Okay. First thing you're going to do is you're going to check the doctor's orders and you're going to check allergies. Anytime you deal with medication, you're going to clean the vial, you're going to make sure it's not expired. Anytime you deal with medication, you're going to want to check it 3 times. Once when you pull it out of the Pyxis, second while you're drawing it up, and thirdly at bedside before you give it to the patient. You also need to follow the patient's 6 rights, which is going to be the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. Now that I've verified my order for 0.4 milliliters of sterile water, I'm going to check the patient for allergies. He has no allergies to this medication, and I'm going to gather my supplies. I'm going to wipe the top of the medication vial to make sure it's sterile. I am going to pull the equal amount of air in, and I'm going to push that air into the bottle. From there, I'm going to draw up my 0.4 milliliters, making sure to look for air bubbles. From there, we want to use the 1 scoop method to put the needle back on to prevent poking. And as you can see, we're at 0.4 milliliters. Okay. From there, I'm going to use clean technique, and I'm going to change out the needle. I'm going to leave the needle in I'm going to leave the syringe in the package, and I'm going to gather all my supplies and get ready to go to the patient's room. As you enter your patient room with the proper medication that's been labeled, you want to ensure privacy. You want to introduce yourself to the patient. Sir, my name's Charles. I'm going to be your nurse today, and I need to ask you your last name and your last 4, the 2 identifiers. And he gives me the last 4 of his social, his birth date, and his last name. Also, is my last chance to ask him if he has any allergies. I'm going to check for allergy band, and I'm also going to check verbally and ask him if he has any known allergies to anything. While I'm doing that, I'd be washing my hands, soap and water, and I'd be applying new gloves. Once that's done, I'm going to explain the procedure. So we're going to give you an intramuscular shot. You're going to feel a slight pinch. You might bleed just for a quick second, and I'll be in and out. Once I've explained that, I've assessed the patient and decided the best place to do it would be in his deltoid. I want to clean the area. Use the 3-finger technique. So I know this is the area I want to use. Pulled my needle, and with a dart-like motion, I want to inject into the skin, slowly administering the medication. Once the medication has been put in, I'm going to pull out the needle. I'm going to check for bleeding. If there's bleeding, I'm going to apply light pressure. And as always, once I'm done with everything, I'm going to take my sharps and put them in the sharp container. Ask the patient if he has any other questions, and take it from there. Thank you.